Okay guys, Timmy coming at you again, and today what I'm going to do for you is I'm going to explain to you the difference between Addison's and Cushing's disease. And when you talk about Addison's and Cushing's disease, you talk about the hormone cortisol. There's a few other hormones involved in Addison's and Cushing's disease, and I'll talk to you about them, but the primary hormone that's involved is cortisol. Cortisol is a naturally occurring steroid hormone, meaning any hormone that has cholesterol as its base in its building blocks is a steroid hormone. So, and cortisol is released from the gland that sits on top of your kidney called the adrenal gland. And there are basically two parts to the adrenal gland. You have the outer portion of the adrenal gland called the adrenal cortex, and you have the inner portion called the adrenal medulla. The adrenal medulla releases epinephrine, a little bit of norepinephrine, and the adrenal cortex releases three hormones. It releases cortisol, it releases DHEA, which is or can be converted to a mild androgen, meaning a hormone that kind of mimics testosterone. And then our buddy, our pal, aldosterone. So those are the three hormones that kind of play a role in developing Cushing's disease or Addison's disease. So how I like to think about it is this way. If you have a cushion, right, you have a cushion of money, you have extra money, right? So in Cushing's disease, you have an excess amount of cortisol, DHEA, and aldosterone. In Addison's disease, you got to add hormones. Why you got to add hormones? You ain't got enough. So it's basically the opposite. You have decreased amounts of cortisol, DHEA, and aldosterone. And this is the thing. Look, you can sit and try to memorize signs and symptoms, or you can try this approach. And to me, this is the best approach, because if you understand how this stuff works, then you don't have to memorize signs and symptoms. You get it. And here's the other thing. This is the cool part. Watch. If you understand how this stuff works, then you will know what you need to do for this person. So the care plan writes itself if you understand what's going on. So let me go first through the normal physiology of cortisol and the hormones of the adrenal cortex. Then, if you understand that, then you'll understand if you have too much of those hormones or if you don't have enough. I'll get into a little bit the difference between primary and secondary. I'll try to cover that in another video. But what I want to do is concentrate first on the effects of these hormones, and then if you have too much or too little. So let's go through the anatomy again real quick. Now watch. Remember gland master P, the pituitary gland? And the pituitary gland has three really, but it has two primary lobes that I want to talk about. It has the anterior pituitary, and the anterior pituitary releases many hormones that will stimulate other glands to release their hormones. So they're releasing hormones or stimulating hormones. And as we learned in A&P, the hypothalamus, which is neural, is connected to the pituitary gland, which is glandular. So the hypothalamus is intimately involved in stimulating the pituitary gland to release its hormones. And one of the big things that causes the release of hormones from the pituitary is, of course, stress, which you are feeling probably right now. You're in clinical, trying to figure this out. What's going on? Them Duke boys, they got my money. I mean, it's crazy. So one of the things that will cause the release of cortisol from the adrenal cortex is stress, and chronic stress, like being in a class for 15 weeks, trying to figure this stuff out. So when the brain, which interprets stress, when you are under chronic stress, that's going to stimulate the anterior pituitary, that lobe of the pituitary gland, to release the hormone ACTH. ACTH stands for adrenal corticotrophic hormone. That's a really fancy way of saying that that's the hormone that's released from the pituitary gland that will cause the adrenal cortex to release its hormones. Now, you have cortisol that's naturally released, and cortisol elevates primarily in the early morning hours. So you get this slow rise after midnight, and then you get this pretty dramatic rise. And it depends, but usually around 4 a.m., and it lasts till about 8 a.m. So, because it's stressful getting up in the morning, you know, and studying and not reading the textbook. So yeah, I'm getting those in even on a video. Thank you. So here we go. Let's say, for example, you're stressed. You're trying to study for your health alterations class, and you didn't read the textbook. Oh no. So 2 curved lines on a circle. You have an adrenal cortex cell. And what's released by the anterior lobe of the pituitary? That's our buddy, ACTH. So ACTH is released by the anterior pituitary, gets dumped into the blood, and you're not going to believe this, but embedded in the cells of the adrenal cortex are ACTH receptors. And when ACTH binds to ACTH receptors on the adrenal cortex cell, it's going to cause the release of cortisol, DHEA, and aldosterone. Now, let's look at cortisol first. And let me break this down for you. Cortisol has several functions in the body. A lot more functions than I'm actually going to go over. These are the ones you need to know. Number one, it's the body's naturally occurring anti-inflammatory. It reduces inflammation. So when you're hurt, right, you twist your ankle, or better yet, you get carpal tunnel syndrome from not opening up the book. That's 2. I should put little tick marks for every time I get one of those not reading the textbooks in. It's a naturally occurring anti-inflammatory. And how it works as an anti-inflammatory, what system produces inflammation? Yeah, you got it. It's the immune system. So it suppresses your immune system. The other thing that it does is it increases your blood sugar. And it increases your blood sugar in several ways. The other thing that cortisol does, hang on. Well, those are its primary effects. So what I want to do now is I want to explain to you, number one, how cortisol elevates your blood sugar. And again, just really quick, as an anti-inflammatory, it suppresses the immune system, right? The immune system function is to produce inflammation. That's how it protects you. So it suppresses the cells of the immune system, lymphocytes, leukocytes, and those kill bad things. So if you're on cortisol, you're on a drug that mimics cortisol. For example, you're taking a dose of prednisone, which is about 5 times more powerful than prednisone. Yeah, I'll get it right. So, yeah, there you go. Well, you can spell it. If you're on prednisone, you have typically some type of chronic inflammation going on. So people who have asthma or chronic bronchitis, or they've been given an organ transplant, they're on drugs that will suppress the immune system because the immune system finds stuff that ain't you and tries to destroy it, right? And it does that by producing inflammation. So its primary effect, one of its big effects, is to suppress the immune system. So if you're on a drug that suppresses the immune system, or in the case of Cushing's disease, where you have too much cortisol, your immune system will be chronically suppressed. Excuse me. That's going to result in you're more susceptible to infections. So one of the things you have to worry about as a nurse, if someone is on long-term steroids or they have Cushing's where they have too much cortisol floating around, is that they're at greater risk for infection. The other thing that the immune system, or that cortisol does, is it increases your blood sugar. And it does so in several ways. And if you understand this, then you're going to understand some of the effects of having too much cortisol. You have that cushion of cortisol. So one of the big effects of cortisol is, remember that when you eat sugar, your blood sugar goes up. What up, G? Remember OG, original gangster? Cut it out. But you also learn too that in order for glucose to go from the blood into a cell, any cell, don't make no never mind, insulin has to bind to a functioning insulin receptor. So one of the big effects of cortisol is to decrease the number and sensitivity, bad color, of insulin receptors. And I don't mean to belabor the point, but if you got too much cortisol around or you're taking prednisone, then that's going to lead to type 2 diabetes. That's why when a patient is placed on a dose of steroids, the doctor will write in the progress notes and in the orders to check blood sugars routinely, because small doses of steroids will decrease the number and sensitivity of insulin receptors, effectively giving you type 2 diabetes. So that's one of its big effects. The other effect, and I'm going to use some big words here, is in the liver. It does a couple of things. In the liver, cortisol, right? So you got a lot of cortisol floating around in your blood. It will take glycogen, which is the stored form of glucose chemically bonded together, right? And when cortisol binds to a cortisol receptor, it will cause the bonds that held glycogen together to be broken, and that will free up glucose, and it will dump that glucose into the blood. That effectively raises your blood sugar. The other thing that cortisol does is it breaks down protein. And it has a really great affinity for collagen. There you go. Collagen, the protein that is found in skin, connective tissue. And collagen is made of protein, and those proteins get broken down to amino acids. When those amino acids are broken down, guess where they go? That's right. Those amino acids that were broken down from collagen, the dermal layer of the skin, they go to the liver. So here's the liver. Then those amino acids that were broken down from the collagen, they go into the liver. Now, you recall that amino acids are unique because they have the amino group. The amino group opened up for Menudo at Summerfest. They sang sugar, sugar, ah, honey, honey. So what the liver does is it hacks off that amino group and then takes the carbon, hydrogen, oxygen skeleton that's left from the amino acids and converts that to glucose through a process called gluconeogenesis. Remember that? And that elevates your blood sugar. Cortisol also, in the liver again, what does the liver produce? The liver produces cholesterol. So what the liver does is it increases the production of LDL cholesterol, the lousy cholesterol. So cortisol increases that and dumps it into the blood. That's why a lot of your patients who are on steroids, their blood sugar is elevated and their bad cholesterol becomes elevated. And then finally, and this is a tough question, so I'll let you think about it for a minute. There's fat in a fat cell. And you got your blood and you got a fat cell, and now you got extra cortisol around, or a drug that mimics cortisol like prednisone. And what that's going to do is that's going to stimulate fat cells to dump fat into the blood, and it dumps it into the form of triglyceride. So let's look. You got labs, right? So you got someone who has Cushing's disease. They have an excess amount of cholesterol. What are you going to see in their labs? You're going to see an elevated blood sugar. You're going to see an elevated triglyceride level. You are going to see an elevated LDL level, the bad cholesterol, lousy, and a decrease in their HDL level. That's going to be right off the bat. So those are some of the big effects of cortisol. The other one, and to be perfectly honest, I'm not sure exactly how this happens, but with excess cortisol, with high levels of cortisol, there is a redistribution of body fat. It's termed central obesity. So what they get, I'll draw a really good picture, is they get a fat face, then they get a big belly, they get skinny arms and legs due to the decrease in muscle mass, the breakdown of protein, and then they get a buffalo hump. I better put it back on this person. There. So that's the redistribution of fat that goes along with cortisol. So they get the kind of pudgy face, they get the buffalo hump, a pad of fat between their shoulder blades, and then they get the big belly. The other thing, now remember, I just had it. What does cortisol do? It breaks down protein. Collagen is protein. So I haven't had a baby yet, but if you're a woman and you have ever been pregnant, if your belly starts growing pretty fast, what will happen is it will stretch and tear that collagen. And if you stretch and tear that collagen and it's far enough apart, scar tissue will form in those places instead of normal collagen. So you will get stretch marks. So that's another sign of excess cortisol. So let's look now, right? Let's look a little bit. Stole these from the internet. Here we go. Got Cushing syndrome here. Got dude, right? So let's go through some of this stuff, right? The personality changes that can occur in people with Cushing's, that has a lot to do with the excess DHEA that's seen in patients with Cushing's. So when you have excess amount of hormones released from the adrenal cortex, DHEA happens to be one of them. So that can cause, they can become aggressive, more man-like if you're a woman. And Cushing's affects women about 3 times more frequently than men. The hyperglycemia, that's associated with the effects of cortisol increasing your blood sugar. The moon face, the belly fat, not shown in this picture is the back fat, is the result of the redistribution of fat that is seen in cortisol. The purple striae or stretch marks is a result of the thinning of the connective tissue and the weight gain, and just basically the weakness of that connective tissue. The osteoporosis is that cortisol, elevated levels of cortisol, inhibit osteoblasts. Osteoblasts build bone. If you got too much cortisol going around, you are not going to be able to build bone, but you still have the effects of osteoclasts that break down bones. So you'll break it down, but you won't build it up. You're going to have, not shown here, is you're going to have elevated blood pressure. And that elevated blood pressure is related to the other hormone that's released in excess with Cushing's, and that is aldosterone. And aldosterone primarily affects the kidneys. And the function of aldosterone is to get rid of potassium in the blood and reabsorb sodium. And you learn that anytime you reabsorb sodium from the collecting tubules of the nephron back into the blood, water will follow by osmosis. And anytime you increase your blood volume, you will increase your blood pressure. That's why they have hypertension. They have an increased ability or susceptibility to infection. We talked about this. What's the function of cortisol? It suppresses the immune system. So if your immune system isn't working as well, you're going to be more susceptible to infection. You're going to have the thin extremities. The reason you're going to have that is because of the breakdown of the protein that makes up muscle. That protein's broken down to amino acids, and then it's sent to the liver to be converted to glucose to elevate your blood sugar. In females, you're going to see amenorrhea, right? They're not going to get their period, and that hirsutism, they're going to get facial hair. And a lot of people think that that's due to the DHEA. There's still some argument about that. It may be a little bit, but more importantly, they believe that it's due to the insulin resistance that occurs because cortisol decreases the number and sensitivity of insulin receptors. So even in women who are obese and then they develop insulin resistance, they will start developing excessive body hair. Or in some cases, people who are on prolonged steroid, right, they're on prednisone for asthma, really bad asthma, they will start developing body hair and facial hair to the point where, you know, it's a pretty good beard and mustache and they need to shave. It's unfortunate. So again, let's look at this. And if you understand the effects of cortisol and the associated hormones that are released from the adrenal cortex, it makes perfect sense. So again, adrenal cortex, what do you release? What are the hormones that you release from the adrenal cortex? Boom. You release cortisol. We talked about its functions, know them. DHEA, which in essence is a mild androgen. It's a mild form of testosterone. And aldosterone. So all three of these hormones in a person with Cushing's disease are going to be elevated. So if you understand what these hormones do, you'll know what happens when someone has Cushing's disease. So one of the things that you have to worry about in terms of electrolytes is you have to worry about Cushing's because they're going to have an elevated level of aldosterone, and that's going to cause increased sodium in the blood and decreased potassium in the blood, right? Because really the only way to get rid of potassium in the body is to pump it out, and aldosterone stimulates the nephron to get rid of sodium, to get rid of potassium and reabsorb sodium. And whenever you reabsorb sodium, you increase the water in your blood, and anytime you increase your blood volume, you'll increase your blood pressure. So you have to worry about monitoring their blood pressure. You also have to worry about monitoring their potassium level as well, because their potassium level can be very low, and low potassium leads to an irritable heart. So that can predispose that person to go into tachyarrhythmias, ventricular tachycardia, ventricular fibrillation, right? Makes the heart more irritable, so you have to monitor that. So that, ladies and gentlemen, is Cushing's disease. I'll do another little video on Addison's disease, and then I'll compare the two, but I hoped it helped. Thanks. See ya.